Hey everybody, welcome to Pick Dr. Osborne's Brain. Today's topic is blood sugar, diabetes, hypoglycemia, hyperglycemia. If you've got blood sugar issues and you want to talk nutrition around those issues, today's the day. Now, if you missed our crash course on the topic, go back and watch that replay. We did a show on Tuesday with that information. It's great vital information you're going to want to have if you're trying to navigate this issue with yourself and your family. So we're going to try to do our best to get as many questions answered in a lot of time frame as we can. So let's dive in. Strict gluten-free, strict grain-free diet for years, coming in with prediabetes readings. Carbs have been cut down, nutrients checked and adjusted. Should I be eating fruit at all? If so, how much? You can have fruit. I would certainly, one of the things that you might consider is using either like a continual glucose monitor or monitoring even with a finger prick glucose monitor. You can buy those at like CVS. And seeing how different foods may be affecting your blood sugar. So for example, classically, we think of foods that affect blood sugar as things that are like fruit or processed sugar foods or high grain or high processed carbohydrate-based foods or just carbs in general. But sometimes people are impacted, their blood sugars go up for various reasons. And I've seen cases where people were monitoring their blood sugar and found that like broccoli elevated their blood sugar or some other type of low glycemic vegetable was creating part of the problem. So if you're doing everything that you think is right and you're still having these readings that are coming back, you might just consider a glucose monitor to see if there are specific foods that you are eating that inherently are healthy and good foods, but for you are driving your sugars up a little bit higher. But also keep an eye on if you're eating a lot of fruit. In the summertime was where people eat the most fruit. You might want to keep an eye on your quantities and serving sizes as well. How does histamine intolerance influence diabetes? Aside from histamine intolerance is typically a byproduct of some type of environmental or chronic inflammation. So in that regard, when you're chronically inflamed, it does and can impact your blood sugar. But I wouldn't look at the two being inherently related directly, like histamine intolerance as a major driving force behind diabetes, et cetera. Wouldn't look at those two in that light. There's more indirect associations, but not a direct correlation to my knowledge. What's the majority of kidney failure patients who end up on dialysis due to the consequence of diabetes? I'm not sure I understand that question. There are a lot of people who end up on dialysis as a result of being diabetic, but I'm not sure I understand the question that you're asking. How long after starting a gluten-free, dairy-free diet should it take before one's A1C starts to fall? I'm pre-diabetic with an A1C of 5.8. So if you're measuring A1C, at least 3 to 4 months, and the reason why A1C is an average of blood sugar over a 3 to 4 month lifespan because your A1C is a measurement of glycated hemoglobin. Hemoglobin is the protein found in red blood cells, and that's why it takes 3 to 4 months to see that shift, to get an accurate, downward shift. You've got to get through a whole life cycle of red blood cells to see those changes. Now, you may actually have improvements in your glucose before that, but to see a lab test change, an A1C lab test change, it's going to take 3 to 4 months. Hi, I'm eating bread from my mother that we make at home. It contains no garbage ingredients, but only wheat flour, salt, water. I don't have any issues with eating gluten. Should I stop? It's hard to answer that question. Should you stop? Are you gluten sensitive? And well, if you're not gluten sensitive and you're eating something that's organic and generally not processed, doesn't have pesticides in it, and you're overall healthy in all other ways, it's hard to argue that you should stop. However, that's where you have to be an analytical person in that regard. Relationship between candida and fungus and Lyme spirochetes, no direct relation. I mean, Candida is a type of yeast. Lyme is a type of bacteria. A lot of times people with Lyme, chronic Lyme, have an immune system that's been compromised, and so they're more susceptible to Candida overgrowth. But there's not like a direct correlation between the two. Not everyone with Lyme has Candida. Not everyone with Candida has Lyme. Can hypoglycemia lead to diabetes? I would argue that hypoglycemia spells are, in fact, diabetes before diabetes is diagnosed. Got to remember that by the time you get a diagnosis, based on the criteria that doctors use for the diagnosis, you've had a blood sugar problem for a long time. Diabetes doesn't just, you don't just wake up with diabetes one day. It's generally, diabetes is decades of cumulative effects that ultimately lead to elevated blood glucose when it's being measured. But you've got decades of your body making more insulin, trying to compensate for your choices and lack of activity, and some of those can lead to the side effect or what people tend to call hypoglycemia years before a diagnosis of diabetes. So when do you wait to do something about it before you recognize it as a problem? That's kind of the argument. So I would argue that hypoglycemia is very much diabetes. It's just before you're going to get a diagnosis. Can you use alpha lipoic acid to lower blood sugar? I mean, you can use alpha lipoic acid to support your body's ability to process glucose, but by itself, if you don't make diet and lifestyle changes, is alpha lipoic acid going to fix your problem? No, and shouldn't be used as such. Or you shouldn't be used with such expectations. Where lipoic acid really can be helpful is in diabetic neuropathy. And there are research studies, even in humans, that show that higher doses of lipoic acid can help to reduce neuropathic or neurological symptoms in diabetics. So, but I wouldn't use it as a means to try to control your blood sugar without changing your diet and your lifestyle. I have a normal A1C, but high fasting insulin. What should I do? Well, you should visit your doctor, a doctor that you trust, that understands things. But if your fasting insulin is high, in your A1C is normal, is what that basically means is your body is producing more insulin to override the problems in your diet and lifestyle. So you're making more insulin to try to clear your bloodstream of glucose. And so your A1C is staying normal. So it's an insulin response. You're overproducing insulin. And this is a very common hallmark of people on the way to diabetes, is that initially, before diabetes develops, they have a hyperinsulin state because the body's just producing more insulin to try to compensate for the extra sugar that you're either consuming or not burning. So, I mean, ideally what you should be doing is working with somebody who understands this, having your diet evaluated, having your micronutrient status checked, because there are things like chromium deficiency, vanadium deficiency, zinc deficiency that can play a role in how responsive your insulin is. And so you may be making more insulin because your insulin's having a hard time communicating with the insulin receptor. And your body's idea is to make more to overcompensate for that. And that insulin receptor requires chromium and it requires niacin for it to properly work. So if you want to understand if that's happening, you got to get micronutrient tested and see if you've got that going on. Does maltodextrin contain gluten? Depends on the source, Marianne, of the maltodextrin. So you can have, for example, wheat maltodextrin, which I wouldn't eat if you're gluten sensitive. Corn maltodextrin, I wouldn't eat if you're gluten sensitive. But there are potato maltodextrins and tapioca maltodextrins that are gluten-free. I think fundamentally, though, we also have to ask, how much maltodextrin, because maltodextrin is basically sugar. And you certainly shouldn't be eating it in any large quantities on a regular basis. I'm taking a berberine supplement. You stated that it has antibiotic properties. Is this okay to take long term? Depends on the person. Generally, Yes, I mean there are a number of safety studies that have been done on berberine that show that there's no imminent danger. I mean, if you're having side effects from the berberine, obviously you want to back off. As opposed to, maybe a better term to use would say that berberine doesn't have antibiotic properties as much as it has microbial balancing properties. And that's where, as a long-term use, it's a higher safety profile, than say an antibiotic, a true antibiotic. Taking Neuromag with the plan to take it long-term. This is magnesium threonate. Is it safe to take magnesium threonate long-term? Yeah, I mean, there's no harm in it. Again, it's a case-by-case basis. Each individual will have their own experiences, but there's no profile of using magnesium threonate that shows people having detrimental benefit over long-term use. Okay, so I have two-part question. Why do my husband and I's tongues hurt and get small blisters on them from certain lettuces we get from our local regenerative farm? I thought maybe oxalates, but the arugula does it to my husband too. I don't care for arugula. Well, it's hard to say. I mean, this is a question more for your CSA, for your local farmers market. Maybe somebody there's lying. Maybe there's some pesticides and other things that they're using that you're being exposed to, or maybe you just have both of you have an individual reaction to those products or to those foods. But I would, that falls under what I call rule number 3 of nutrition, which is if your body reacts to something negatively, stop doing it. That's your body's way of telling you to change, right? So regardless of the perception societally that people think that lettuce is super healthy or arugula is super healthy, if it's causing you adverse symptoms, that's all that you need to know to take a change or to make a change. Let's see here. Is there anything that can help with stopping wanting to eat all the time? A lot of times hypercraving or hyperphagia is a symptom of somebody eating food where they're not getting adequately nourished. And so maybe you're eating foods that are too low in nutrient density, and so your hunger mechanism never shuts off. Maybe your diet is too low in fat, so your hunger mechanism never shuts off. Maybe you're low in certain nutrients, so your hunger mechanism doesn't shut off effectively. Like these are things that I would encourage you to explore, because it's not like a product that you're going to take that's going to stop you from wanting to eat more. If your body's going to override that. Your body communicating to you that you need to eat more is a sign of something deeper beyond a supplement that causes appetite suppression or a drug that causes appetite suppression. Can a person manage diabetes with diet alone? Yeah, 100%. Diabetes is a disease of choice. Now, if we're talking about type 2 diabetes, not type 1, but it's absolutely a disease of choice. And what I mean by that is you make the choice as to what you eat. You make the choice as to when you sleep and how much you sleep and how much sunshine you get and how much you exercise. Those are all choices, and those are all choices that can lead to diabetes or lead to the resolution of diabetes. So don't ever let a doctor tell you that you need to be on a medicine for the rest of your life and that there's nothing that you can empower your body and yourself to do to overcome type 2 diabetes. I have high insulin. How do I lower it? You figure out why it's high. For a lot of people, I've mentioned this earlier, chromium deficiency, zinc deficiency, vitamin B3 or niacin deficiency all play a role in supporting the insulin and the insulin receptor mechanism. And so we'll see sometimes people having high insulin as a result of having those deficits. So get with your doctor, have those levels measured, and get some clarity around why your insulin levels might be going up. You might also have to just simply change your diet. A lot of people have high insulin because they eat too much carbohydrate. Where should you fall in your diet around carbohydrate? If you're a diabetic, it's a good place to start is don't eat more than a third of your total calories from carbohydrates. Start with, I call it the rule of thirds. So if you have a 1,500 calorie diet, 500 of those calories should be protein, 500 should be fat, and 500 should be carbohydrate. And then continue to work from that place. Like if you start at that point, that rule of thirds, and your blood sugar and your insulin still stay high, then you might consider adjusting your carbohydrates down a little bit lower. But ultimately, also, one of the most important and valuable things to understand is your nutritional status, because to properly process carbs into energy, there are all kinds of different micronutrients that are necessary along those pathways, from zinc and magnesium to all the B vitamins to CoQ10 to vanadium to chromium. So looking at those things, you may have a metabolic block somewhere that is, easily rectified by having that understanding. How to stop family and friends from serving gluten and grains to children with celiac. Quit allowing your children to go spend time with those families and friends. If they're not respecting your wishes as a parent with your children, X them out. I mean, those are your kids, and if they don't have the level of respect for you as a parent with your own children, they just don't need to be a part of that child's life. At least that's my attitude about it. If somebody were doing something with my child that I explicitly said don't do, they would be fired or immediately excommunicated from their lives until we had a heart-to-heart and we came to some type of agreement that they were going to respect my wishes as a parent. So don't let anybody overstep your boundaries as a parent. Okay, let's see here. Just saw your video on anemia. I have been taking heme iron for 4 to 5 months. My cofactors B12, B9, and other ones are all optimal, but my hemoglobin just won't rise. So I would argue that if you're telling me your B12 and your B9 are optimal, how were those measured? Were those measured intracellularly? Were those measured in the red blood cell? Or were those measured in your serum? If they're measured in your serum, you're wasting your time and effort. It's very rare to find nutritional deficit in the serum because of the liver. The liver can release B vitamins and redistribute them into the bloodstream when there's a deficiency state. We call that redistribution. And so this is why a lot of serum tests can provide a false negative. So you need to have an intracellular test done and make sure that B12 and B9 are actually where they should be. Also, you might consider copper. Copper deficiency can also contribute to anemia. It's very important for hemoglobin production, and you might have a copper issue. You might also have a vitamin B6 issue, also necessary in heme production. And if you haven't investigated those two as well, I'd highly encourage you to do so. My sister has tinea versicolor. Any tips? Have her visit her doctor, but she could use some skin-based antifungals. They make a number of over-the-counter remedies. Some people apply directly, like silver or hydrogen peroxide to support that, but I would have it investigated. Okay, let's see here. Will tinnitus ever go away? Depends on what's causing it and whether or not you're addressing that. Hard to say. How long does it take, or can it take, for symptoms of sugar to go away after quitting? Weeks. I mean, depending on what kind of symptoms you're having and the manifestation of your issue. But I mean, you cut out sugar. Generally speaking, if you're having acute responses to sugar consumption, you're going to notice some improvement relatively quickly. It may take months. It just depends. There's not a one size fits all. Any way to clear cavitations without surgery? Talk to your environmental dentist or biological dentist. I'm not a dentist. However, they may have some solutions for you, like some deep root cleaning or deep root treatments. But because it's not what I do every day, it's not something I'm probably best versed to answer for you. How does gluten affect hair growth and the thyroid? So gluten directly, depending on the person, but gluten has been shown to cause increases in thyroid antibodies. So certainly you'd want to understand whether that was happening for you. As far as hair growth, I did an entire show on gluten and hair. You might want to go back and check that out if we can post a link up to that show for Jeanette. What is a type 2 diabetic lacking, and what is the case of muscle loss? Age in the late 60s. I'm not sure I understand your question specifically, Betsy. There's, what is a type 2 diabetic lacking? I mean, show me 100 type 2 diabetics and I'll show you a completely different profile of what each one of those people are lacking, because it's not always going to be the same thing. So that's hard to answer that question. As far as the cause of muscle loss, muscle loss, there's a lot of reasons people can lose muscle. Probably the biggest one is they use their age as an excuse to not have activity, or they use their job as an excuse to not get activity, or they use their pain as an excuse to not have or perform activity. You have to use your muscle or it will atrophy. That's kind of a law, if you will, of muscle maintenance. Beyond that, you have to make sure you're eating enough protein. If you're not eating adequate protein, you won't have a reservoir to help maintain your muscle. And so a lot of people with diabetes that lose their muscle, look, they don't eat enough protein. They've been told all the rhetoric right now that's going around, which is, cows eating grass destroy the planet, and you should eat a plant-based diet. And here, by the way, here's some processed soy junk, fake meat that you should eat to save the world. All that's nonsense. It's making a lot of people very wealthy, but it's not making your health very healthy. So you have to ignore that rhetoric and know that eating animal protein is a good thing for you, and eating adequate amounts. And that adequate amount is a lot more than what the USDA recommends, or what the RDA recommends, recommended daily allowance for nutrients. So get adequate protein, get adequate motion and movement, check your carbohydrates. Those are just the low-hanging fruit of what you should be thinking on and focusing on. And then beyond that, it's nuance. It's nuance because it's different for different people. Having a thyroid nodule, what would be the best way to get it to go away? Figure out why it's there. You can have a thyroid nodule for a lot of different reasons. Iodine deficiency can contribute to thyroid nodules. Gluten exposure can contribute to thyroid nodules. Environmental mold exposures I've seen cause thyroid nodules. There's a lot of different things that can cause a nodule. Fluoride toxicity, bromide toxicity, too much chlorine, all of those inhibit your iodine. So all of those things are areas or avenues to explore. If you're already immune compromised, how long before toxic black mold starts affecting you? It's very different for different people. It's not just a matter of how long does it take for any one person to start being affected by toxic black mold. It's how much exposure do you have? What is the dose of that exposure? What is your genetic proclivity to react to that? Do you have a greater genetic propensity to react? What is the current state of your health once your exposure begins? Are you well nourished going into that exposure? Do you have muscle reservoir going into that exposure? Do you sleep adequately going into that exposure, right? So there's so many variables. That's why it's not a one size fits all. That's why we can't just say, every person with 1 hour of exposure to toxic black mold gets sick in 1 hour. It's a very unique, individualized reaction. What factors can falsely elevate A1C? My fasting insulin is 4.7, but A1C was 5.8. What I would consider, or what I would encourage you to do, is get a retest if this has been consistent. So like if you have a 4.7 fasting insulin, but a 5.8, and it's only been on one series of testing, I would consider that there might be a lab error, and I would definitely repeat test to validate that that is what's actually happening. Don't exercise before you go in to get your blood work done. Exercise can impact your insulin. And so you might be going in that state where you've exercised on, even though you're as well as you're fasted, but your A1C is high, but your insulin is low because of the exercise and not because your blood sugar is being well controlled. So consider getting your blood drawn in a fasted state without having had any exercise. Would be one common thing that could A1C and your insulin readings and make them not match. Do stevia and xylitol spike insulin? No. Are histamine intolerance and celiac connected? Can be. Many people with gluten reactions do develop histamine response as well, but it's technically celiac disease is it's a humoral immunity induced disease, meaning that the body produces antibodies that ultimately lead to degradation of your GI tract or your villi. So most people with celiac disease have elevations in antibodies that destroy their gut lining. It's through the destruction of that gut lining that you get secondary and tertiary downstream problems. Histamine intolerance can be one of those, because when you destroy your gut lining, where you produce histamine, the actual enzyme that breaks histamine down, called DAO, diamine oxidase, you can damage your ability to make DAO with celiac disease, and then you can develop histamine intolerance as a result of not producing adequate enzymes to break histamine down. So that's one of the more common or more realistic types of associations. Should I take enzymes for pancreatitis? It's not a bad idea. Talk to your doctor. But it's not a bad idea, depending on what kind of enzymes, but a good full spectrum proteolytic enzyme formula taken on an empty stomach can be very supportive in that type of situation. Can thyroid nodules go away? Yes, they can. Can I heal them with diet or by not eating gluten? Time will give you that answer, but I've seen it happen for a lot of folks where they go on gluten-free diets and the thyroid nodules go away. So it's possible that it could work for you as well. All you have to do is try. I came back positive to gluten on a genetic intolerance test, but non-reactive to kamut. Does that mean I can eat kamut? No, it doesn't. So an LRA test measures delayed hypersensitivity response, and that's not always the same reaction that you get with gluten. So with gluten, you can have multiple different types of responses. You can have a delayed response. You can have an antibody response. You can have an innate immune system response where toll-like receptors are being activated and causing leaky gut and intestinal damage as well. So there's a number of different mechanisms there, and I think that's where you may be confused. If you have genetic positivity for gluten predisposition, you shouldn't eat wheat at all. That's my opinion of the matter. So should someone who's going through B6 toxicity avoid vasodilators? I mean, why would you want to take vasodilators? To me, the better question is, why would you want to take vasodilators? Like, not should someone with B6 avoid them, but why would you need a vasodilator? If your body's healthy and happy and doing what it's supposed to do, why would you want to take things to dilate your blood vessels beyond their natural capacity to dilate? Maybe rephrase your question, but I don't know that necessarily that somebody with a B6 toxicity should avoid. If you're talking about vasodilators like arginine, natural amino acid, not necessarily should you avoid B6, or should you avoid arginine, but I don't know if that's what your question is. If you're talking about medicinal vasodilators versus natural, things that naturally help with supporting vasodilation. What's the best way to lower triglycerides? Is to quit eating so many carbohydrates. Simply put, triglycerides are fat in your bloodstream. And if they're high, if they're above, in my opinion, if they're above 75, that's high. Now the lab reference range for most labs is anything above 150 is considered high. But if you're struggling with high triglycerides, the best way to lower it through diet is to quit eating so much carbohydrate, because your body will take excessive carbohydrates and it's really good at storing them, but before it stores them, it will convert them into fat, triglycerides, and then it will store them. So controlling your carbohydrates, one of the best ways. Other things that we know can help with triglycerides is omega-3. Getting enough omega-3 is very important for the regulation of cholesterol and triglycerides. So omega-3 is very important in that regard too. You might have your doctor do an omega check on you to see where your omega levels are. I have type 2 diabetes in my kidney stage. There's some typos here. I think what you're saying is you have type 2 diabetes and you're in stage 3 kidney failure. What that means is you better make some changes, Pam. Because if you're in stage 3 kidney failure, that means your kidneys are failing and you're ultimately probably going to end up needing dialysis if you don't make meaningful changes now. So you got to get that diabetes under control. How does working the night shift affect blood sugar in the body? Well, I mean, it's not that working the night shift per se is going to cause you to have diabetes or blood sugar problems, but night shift basically you retrain your body's circadian rhythm to be awake during the night when your cortisol is supposed to be low, and so now at night your cortisol is probably going to be high. And as long as you're going to bed in a darkened place where you're still getting good sleep and you have good darkness where you sleep, you're then going to have a period where your cortisol levels drop. So it's just a reversal of your circadian rhythm of your cortisol. So it might not affect your blood sugar if you're doing it right. If you're going home and getting a full 8 hours of sleep and black out your windows and try to trick your body into thinking that it's night when it's day when you're sleeping, and that will have a better impact on controlling your blood sugar as it relates to your cortisol rhythms. So there's a lot of you giving me specific lab tests and lab values. Again, the purpose of this Q&A is not for me to medically diagnose anyone or give direct medical advice. I'm not going to comment on your lab tests. Just don't want you to be upset with me if I don't get to your question. If you have a question you want me to answer, fire away, but don't put lab tests and lab reference ranges into your question because I won't answer it. I'm just going to skip it. My naturopath says I should eat fruit away from food at least 30 minutes to 1 hour. Can you eat fruit with a meal? Yes. Unless you where some people get into trouble with fruit with a meal is that, and there's this whole kind of realm of what's called food combining, where when some people mix like fruit with meat, they don't digest very well and they get a lot of upset GI gas and disturbance. And so if that's happening to you and your naturopath, gave you that advice, then that was probably good advice. But if that's not happening to you and you feel fine eating fruit with your meal or directly after your meal, there's no need to necessarily wait. Some states require a doctor's script for a continuous glucose monitor. How can one encourage their doctor to write a script if you're not a dietetic or not a diabetic and just want to keep your body insulin sensitive? An honest conversation, go in and talk to your doctor about prevention. And, an ounce of prevention is worth a pound of cure, and see if they'll write it for you. Now, they may write it for you and your insurance won't cover it and you'll have to come out of pocket to pay for it. But that's the conversation that you want to have. Outside of moving out of the state or, visiting a doctor in a different state and getting him to write you one out of state. That's an option too, depending on where you live and how big the state you live in is. High GFR, end-stage chronic kidney disease, stage 3. How to know if it's gluten sensitivity versus parathyroid benign tumors? Parathyroid benign tumors don't cause stage 3 chronic kidney disease, and that wouldn't be my thought anyway. I would say get tested for gluten sensitivity. If you're trying to understand whether gluten is contributing to kidney damage, get tested, because otherwise you're just going to guess. But high calcium and vitamin D3, in my opinion, high calcium and vitamin D3 are not going to cause you to develop stage 3 kidney failure. They're more of a consequence of kidney failure, and that when your kidneys are failing, they can't properly filter, and so you end up with elevations in calcium, but not the other way around. So I would have a tendency to believe that there's something else that's contributing to your kidney failure that's leading to the calcium vitamin D issue, as opposed to the calcium vitamin D issue causing the kidney problem. Do you recommend doing 8 16-hour fasting to manage diabetes? No, I don't think diabetes needs to be managed. I think if you have a good diet and a good lifestyle, you don't require fasting to control any kind of diabetic behavior. Now, can fasting be beneficial? Sure. And, is there, in our society, so the reason I say this, because women don't do as well with a lot of fasting. Like, this is one of the things, a lot of women just don't do well with longer term fasting. Now, 8, 16 hours, if you're doing an 8-hour window of all your meals and a 16-hour, follow-up 16-hour intermittent fast, a lot of women can handle that pretty regularly, pretty decently. But depending on their level of stress and the level of exercise that they have in their lifestyle, some women can't handle it, and so it becomes problematic, and then they end up becoming hypoglycemic, and then that triggers cortisol release and leads to sugar dumping, and then that's not good either. So it's fasting can be helpful if it's helpful for you, and you use it and you feel good, more power to you. But I just don't think that fasting. Well, I think that the question is, how do you manage your diabetes? I think that's the wrong question. You don't want to have to be in a situation where you're managing diabetes. You want to be in a situation where your diet and your lifestyle are congruent with good health, and you no longer have diabetes, and there's no managing it. There's just managing your behavior around good health. And maybe I'm nitpicking at you, and I'm not trying to be that way, but I want to give you sound. Words matter, and if you're saying manage diabetes, to me, that means if you're trying to manage it, then you're not trying to solve it, right? It doesn't require management. Diabetes is not your best friend that moves into your apartment building next door and you have to manage the relationship for the rest of your life. Diabetes is a manifestation of bad choices over time. And if you understand what those choices are and change them, then there is no management, because it goes away. Let's see here. How to control type 1 diabetes? That's a good question. It's different for different people, Charles, but the same way. I mean, the difference is that with type 1 diabetes, you most likely require prescriptive insulin injections. And so that's part of how you're going to control and manage it. But you should still be trying to eat and exercise in exactly the same healthy type of way, because if you do, you require less insulin. Now, unfortunately, the field of dietetics teaches to inject your insulin and manage your insulin around your carbohydrates instead of managing your carbohydrates around your insulin. In other words, if you get a dip in blood sugar because your insulin's too strong of a dose, instead of, a lot of times they say, don't necessarily reduce your dose, just eat some sugar, right? Pop a piece of candy or drink a glass of juice and get your sugar to come up because maybe your insulin was too high. I think that's bad management advice. I think if you're taking the insulin and your blood sugar is staying low because your dose is too high, then you should talk with your doctor about adjusting your insulin dose. But it's the same tenets and principles. The one caveat between type 1 diabetes and type 2 is that you have autoimmune destruction of your beta cells in your pancreas, so you actually don't make insulin, so you require exogenous insulin injection. But if you want to use less insulin, and if you want to manage it better, because with type 1 you do have to manage it because you've lost your ability to produce insulin, You still have to eat right. You still have to exercise. And if you do those things, you will need a lot less insulin. But you do need to work with a good practitioner, a good doctor who understands that. And they're not trying to get you to chase your bad insulin prescription with excessive carbohydrate consumption, because this is the management style for most. Again, they say manipulate your carbs around your insulin dose instead of the other way around. I have seen type 1 diabetics where I've seen cases where they needed half the level of insulin they were taking once they adjusted their diet and their exercise. And it just, you have to be careful and you have to monitor that. And you should do that. If you're going to try to do that, you should do that under supervision for sure. But same way, same management. Let's say I'm 60, should I be taking calcium? If you're deficient in calcium, yeah, you should try to eat it too, Kathy, but just because you're 60, that's not like the ticket that everyone needs in order to take calcium for the rest of your life. This is another one of those myths in nutrition. You turn 60, your doctor says, oh no, your bones, you better be on a calcium supplement. I've even seen idiot doctors in some cases where they prescribed their patients Tums with calcium. I had a woman, she was pregnant. She had a calcium deficiency. We measured her calcium. It was low. I put her on calcium, a very high quality and dose specific level of calcium. She goes back to her OB-GYN. Her OB-GYN says, oh, you don't need that calcium. Here's some Tums with calcium. Just take that instead. Now that's how much sometimes doctors are idiots about nutrition. This OB-GYN had no business talking about nutrition with my patient. Tums is an antacid. And when you take an antacid, whether it's Tums, Rolaids, or Pepcid, or Zantac, or Nexium, these are all drugs that suppress acid, you will suppress your body's ability to absorb calcium. And that's why it was such an asinine statement. Take Tums with calcium is an oxymoron. It's basically guaranteeing that you won't absorb the calcium and the Tums, and it's suppressing your stomach acid, which increases the risk for the development of an infection, but also increases the risk of other nutrient deficiencies like magnesium and zinc and selenium and vitamin B, especially vitamin B12 and iron. And here we're talking about a pregnant woman. Let's suppress your stomach acid so that you absorb nothing from the food that you eat and cause malnutrition in your body and malnutrition in your baby and increase the risk for birth complications because I'm an idiot and I know nothing about nutrition. Anyway, I'll stop the rant there. It makes me mad because a lot of doctors just blatantly don't know what the hell they're doing when it comes to nutrition, and this is one of those areas. So just because you turn 60 is not your golden ticket to need calcium. You should get your levels tested. Even if you have osteoporosis or been diagnosed with osteoporosis, it doesn't mean that your bone loss is being caused by a calcium deficiency. There's so much more complicated nuance to understanding bone loss than just calcium. But most doctors don't know nutritional biochemistry, so their simple solution is calcium and vitamin D, and it's just not good advice. So hopefully that's helpful for you. And if you have been diagnosed with bone loss and you're a woman, you need to watch my course on bone scan myths. Go check that out. I'm going to put a link in the commentary for you to check that video out, because that video could save your life from a bunch of nonsense that you might hear. I'm having phlegm from acid reflux. Is there a natural way to go about supporting this? I mean, first of all, you want to figure out why you're having phlegm. So you could take some natural things. There's certainly plenty of things that can coat your stomach, that can soothe your stomach. Aloe is one of them. Deglycerinized licorice, slippery elm, okra. These are all good things that can produce like a mucus coating around your stomach. But why are you having the phlegm? Why are you having the acid reflux? You got to answer that question. And for many people, acid reflux is either it's either a microbial imbalance or an infection, like Helicobacter pylori is a bacterial infection that can cause acid reflux, or it's you're just eating bad food. You're eating food that your body is being damaged by, and it's creating a reflux-like response that's leading to the symptoms that you're experiencing. Do you think if you have lymphedema, it can be a cause of cancer? Well, if you have lymphedema, yeah, it's important to manage lymphedema. If you have lymphedema, you have to understand what's happening is your fluids are pooling into your lower extremity, and so those fluids, are now not being basically recirculated back through your lymph system. Your lymph system is like the garbage can. It's kind of cleaning your blood and taking the garbage out. And so when you have a toxic burden overload, can that contribute to cancers? Yeah, of course it can. I mean, cancer is multifactorial. There's not one driving force or cause behind it. But having a lymphatic system that's not properly cleaning your blood, in my opinion, could definitely contribute to an increased risk for the development due to the inability to get toxins out. I've recently been told I have complex regional pain syndrome from a crushing injury back in 2023. What do you suggest to do to cure oneself? Take for nerve pain. So chronic regional pain syndrome is a tough diagnosis. For a lot of people that I have seen, it's their sympathetic nervous system is in overdrive. It's just on all the time, and you have to calm that down. And so there are a number of things that you can do to support calming down the sympathetic nervous system, from meditation and prayer to sensory deprivation therapy to a number of other modalities like acupuncture, good chiropractic care, and even some herbals that are adrenaline adaptogens. So things like ashwagandha and theanine and GABA can all be very supportive in that situation. But in a lot of the cases that I've seen post-injury, a lot of these individuals also are gluten sensitive. And I've seen going gluten and grain-free for chronic regional pain syndrome be tremendously effective and helpful. So if you haven't changed your diet or thought about changing your diet, I would look at that, because diet can sometimes be a trigger to keep the sympathetic nervous system turned on. And if you have food sensitivities that you're incorporating on a regular basis in your diet, that may also be stopping you from healing and getting better. How does being past 70 affect a person's absorption of vitamins? It doesn't. The generic rhetoric is, because you're older, your stomach and your intestines digest less effectively and absorb less effectively. But that's not so much associated with age, Linda, as it's associated with accumulated damage over time. So as a person ages, if they make a lot of bad choices with time, right, those bad choices lead to symptomatic regression and problems in their body. That's not the same thing as aging. That's my choices over time leads to basically fundamental breakdown. But aging in and of itself doesn't affect your absorption of vitamins and minerals. It's your behavior over time. So get your behavior right, and you can absorb very well the vitamins, the minerals, the protein, etc. If you're still struggling, or maybe you have a chronic history of 50, 60 plus years of GI tract inflammation and damage, you might consider, supporting your digestion with betaine hydrochloride or ultra acid or some type of good quality enzyme formula. If you're lacking a gallbladder, you might consider using, ox bile as a supplement to support your digestion of fats. But, beyond that, it's what you do in the day to day that's going to help your body work or prevent it from working properly. Let's see. What do you recommend instead of an antibiotic after wisdom tooth removal in a 15-year-old? Well, I recommend that you talk with the doctor who removed the wisdom teeth. That's the first and smartest thing to do. And talk to the doctor about your concern for just, a lot of doctors and dentists and oral surgeons will just put people on antibiotics just in case. They're not doing it because you have an infection. They're doing it as a preventative in case you might get an infection. And if you talk to your doctor about that and say, look, that may not be what I want to do, is there another option? They may have like an oral rinse that you could use that is more preventative, to help reduce the potential risk of an infection after a surgery, as opposed to a systemic antibiotic that can, wipe out the gut flora and create problems. There are a lot of things in the mouth, rinsing wise, that can support you in this situation too. I would probably, if it were my son, I'd probably have him rinse with silver, ionized silver, as a preventative, and then keep a good eye on it and have good surgical follow-up so that you can make sure that an infection's not setting in. But an antibiotic is not always necessary. Sometimes it is, and sometimes it isn't, and that's the conversation you should have with the dentist. Any advice on eradicating liver flukes? I've had gallbladder liver pain for a while and just did a flush. Tons of what seem like liver flukes have come out. You get with a good infectious disease doctor. If you've got liver flukes, they don't take that lightly. That's a serious problem, and you don't want to mess around with a do-it-yourself at-home job in that kind of a situation. You really want to work with an infectious disease expert who knows what they're doing. Regarding chromium, doctor once recommended chromium polynicotinate for absorption to all patients. What, in your opinion, regarding the best form of chromium? Polynicotinate chromium is a good form of chromium. There are better versus not good ones at all, and polynicotinate is a good one for sure. And that's, if you check out our ultra chromium, it's actually the type of chromium that we use in ours as well. My husband ate some ice cream after 3 months of being carnivore and had some sort of hypoglycemic attack. After an hour, he was delirious and not responding. Any thoughts? It's hard to know without actually having some type of viable biochemistry on him, because your words, not mine, but your assumption is that it was a hypoglycemic attack, but it may have nothing to do with his blood sugar. It may have to do with an immunological response against the sugar in the ice cream or the dairy, or any of the other number of variety of things that could have been in that ice cream that his body, after being carnivore, had said, hallelujah, we're no longer being poisoned. And then when he poisoned himself acutely, his body went into shock and he passed out. So that's a thought, but hard to prove one way or the other without any kind of laboratory. How to treat celiac disease with leaky gut? I mean, first and foremost, you have to be gluten-free, grain-free. Follow no grain, no pain. If you've got leaky gut and you've been diagnosed with celiac disease, don't follow the traditional gluten-free diet that they're going to recommend in the hospital when you get your diagnosis, because that diet has a 92% failure rate to help you recover your villi, and a 92% failure rate to help you overcome your inflammation. So no grain, no pain would be the diet that I would recommend that you do. Beyond that, you need to work with a practitioner who understands it and can give you unique and individualized testing to help give you specific guidance. Is there a way to make carrot juice taste better? Hold your nose. Taste is relative. Hold your nose. Add something else to it. Flavor it with some other kind of vegetable as well. My family members all have attention deficit disorder, and they're all different. Oh, not a question. My neighbor has black mold in their trailer. What are my chances of breathing it in from next door? I mean, it's next door. As long as it's not in your house. I mean, unless you have a direct pipeline from your house to their house, I would worry less about it. I mean, that being said, can you smell mold when you walk outside or walk near their home? Because some houses really can breathe and emit it if the problem is bad enough, and you do want to be aware of that. But, hard to say, hard to answer that question. Can you take enzymes like proteolytic enzymes to shrink thyroid nodules? I've heard that that's the way to go, that in lots and lots of green tea. I don't know, Tommy, where you're hearing that kind of stuff from, but I've never seen anybody shrink their thyroid nodule as a result of using proteolytic enzymes and without changing their diet and their lifestyle, among other things. If you're trying to shrink thyroid nodules, you need to know why they formed. And short or lacking that knowledge, I don't think any supplement that you take is a catch-all, cure-all miracle. Please talk about autism and gluten. I think we have a pretty good article on that if you want to read a little bit more about that. Maybe we can post that link up for. Okay, so response or reframing the question from earlier, should someone going through B6 toxicity avoid vasodilators? For example, magnesium, omega-3, or stevia? No. There's no need to avoid those other nutrient supplements because of a B6 toxicity. Questions on carnivore diet, having been having body tingling primarily in the limbs and face. What may help the tingling? It's hard to say what's causing the tingling. I mean, you're on a carnivore diet. How long have you been on a carnivore diet? Did you have the tingling before you went on the carnivore diet? And, you know, I mean, there's just too much left unsaid there, Sandra, for me to be able to speculate any better. If diabetes can be autoimmune, if you're talking about type 1 diabetes, yes, there are antibody tests available to check for. There's a GAD antibody, for example, in type 1 diabetes that your doctor can measure. My asthma cleared on a gluten-free diet. Is this a coincidence? No, it's not a coincidence. It's an observation that you experienced, and it's very real, and it doesn't matter what anyone else tries to tell you. Your observation is that your asthma cleared when you changed your diet. Can gluten cause asthma? Absolutely. Maybe we can post our video for Leon so that he can go learn more about the mechanisms behind why his asthma got better. My husband and I just did micronutrient tests. We're excited, waiting to see the results. Thank you. You're welcome, Lily. If we cut out most gluten and grain, where do I get my carbs from? I mean, there's carbs in fruit, there's carbs in vegetables. You've got tons of options of where you get carbs from. I think a lot of people think that they have a diverse diet, but what they really have is they have an amalgamated diet that's just got grain shaped in different forms. You know, they have grain shaped in the form of sandwich bread and pasta and cereal and donuts and kolaches and beer and a variety of a sundry of different things, but their diet is really grain oriented. If we look at the US alone, 60% of the calories come specifically from wheat in the average American diet. So that is, in my opinion, one of the least diverse diets in the world. It's perception, right, as to what you're eating, but there's lots of carbs available and lots of other foods beyond grain. Can a non-functioning thyroid be healed? If you still have your thyroid, first of all, I would argue the premise that it's non-functioning. I mean, show me a person that's not producing any T3 or T4 if they have a thyroid gland. I have never seen that to be the case. So non-functioning thyroid is probably a term your doctor used, and it's a mislabel because you don't have a non-functioning thyroid. You could have a low-functioning thyroid, and the only non-functioning would be if you've had it removed. And no, if you've had it removed, that's not going to heal. You're not going to grow the organ back. But if your thyroid is low functioning, can you improve its function with diet and lifestyle change? Yes, absolutely. What kind of vegetables will you recommend to reintroduce after being carnivore for months? Carnivore only made me all sympathetic insomnia. We'll try to. Not sure if I understand what you mean, but I mean, what vegetables would you like to try to introduce? Why did you go carnivore? What were your symptoms before, and did they improve on a carnivore diet? Because the answer to that question is in the answer to the questions that I asked you back. For example, if you are benefiting from a carnivore diet because it's low in oxalate, you have an oxalate problem, then the vegetables that you would consider reintroducing would be vegetables that are lower in oxalate or fruits. So I would, you know, again, it's a nuanced question. I can't quite answer without more details. How would you respectfully tell a doctor that you're not interested in vaccines? Just like that, Kevin, I would say, look, doc, I'm not really interested in vaccines. I believe that my body has the ability to protect itself. And although I respect and value your opinions and helping guide me on my journey in health, I would also ask that you respect my philosophy and my beliefs around vaccines. That's the way I would handle it. And if they're, if they're adamantly wanting you to have them anyway, move on. What a lot of people don't realize is vaccines a profit center for doctors. It's unlike other medications. Vaccines are a primary source of profit in the doctor's office. And this is, in my opinion, one of the reasons why a lot of pediatricians, have failed to look at this whole topic objectively. That being said, most states, I don't know where you live, but most states have a religious or conscientious objection waiver form that can be filled out. And so once you fill this type of form out, it protects you legally from any kind of, more than anything, if you're an adult, it doesn't matter. But if you're a child, and you're trying to protect your child and you don't want that to happen, then you get your conscientious objection form filled out for your child, and then that protects them from the school being able to, kick them out or not allow them entry, especially if it's a public school. What are your thoughts on orthosalicylic acid for calcium absorption? You're talking about orotate as a binder or as a carrier for calcium. It's decent. Thoughts on diabetic neuropathy? I think if you've got a diabetic neuropathy, you need to figure out, first of all, why you develop diabetes and change those behaviors. And if you're trying to overcome a diabetic neuropathy, there are a lot of nutrients that you can take to support yourself, alpha lipoic acid, vitamin B12. But ultimately, you want to get tested because you could have a diabetic neuropathy due to the medicines. I mean, the medicines that people take for diabetes can deplete CoQ10, can deplete vitamin B12 and folate, and those nutrient deficiencies can cause neuropathy. So sometimes diabetic neuropathy is actually diabetic drug-induced neuropathy and not diabetic neuropathy at all. So you have to, in my opinion, you want to get those things measured so that you understand what's driving your specific neuropathy and don't make assumptions that it's just the diabetes. Is it necessary to get on prescribed medicine right away, or can I start a very strict diet to avoid this? You've been diagnosed. So, I mean, I can't answer that question specifically for you, Charlotte. That's between you and your doctor. But are you going to die tomorrow because you're diagnosed with diabetes type 2 today and you don't start your medication today? Probably not, at least not from diabetes. Now, nobody can predict what's going to happen in the future, but type 2 diabetes is not an acute life-threatening disorder this week. It's a lifestyle disorder that you can change. And if you talk to your doctor, a lot of times you say, Doc, look, I want to do this naturally. I want to change my diet and start exercising. I don't want to start the medication. Have that conversation with your doctor. A lot of times that's part of the standard of care. That's actually before they give you medicine. They're supposed to talk to you about diet and lifestyle first. They're supposed to have that opportunity to, to get it corrected without the need for medication. So, but again, that's a decision you got to make, one that you have to be comfortable with your doctor. Why is my wife not hungry? She eats very minimal. I don't know. Not enough details. What do you think of? If you're asking me what I think of Ozempic, I think that's the question here. Semaglutide or Ozempic. I'm not a fan. But I also think that some people, if you take a person who's 45 pounds or more overweight, they're morbidly obese, and they use a drug like that, and they get their weight under control as a kickstart to then being able to exercise and change their diet and do the right thing, I think it's a personal decision that each individual needs to make. I mean, but the problem with drugs like semaglutide is that they increase the risk of, gastrointestinal paralysis. And that's a bad thing. We don't want our guts to be paralyzed. We don't want our guts to not have great motility. We don't want to be backed up. It also increases the risk of pancreatic inflammation. So you could potentially damage your pancreas, which is a very important organ for a number of functions, including digesting your food, but also in terms of producing insulin and controlling your blood sugar. So I think anybody can do it naturally if they have the willpower and the means and the gumption to get educated about diet and lifestyle change without having to take those drugs. I think anybody could do it. But I think, for some people, maybe it's the kickstart to their program. I don't know. I think everybody gets to make their own decision. But if you ask me what I would do, I would stay as far away from those medicines as I possibly could, because at the end of the day, they're not going to solve your problem. And I don't believe in false solutions. I don't believe in lies that are coated in gift wrapped paper and perfume and telling us that it's going to solve our problem when our problem is ourselves and our own choices. Like, to me, that ultimately is that the ultimate truth is the truth most of you don't want to hear, which is get off your ass, eat better, get an education, take personal responsibility about who you are and what you're doing and the decisions that you're making around your diet and your lifestyle, and quit trying to blame your genetics and quit trying to blame your doctor and quit trying to blame everyone else, except for looking in the mirror and being the best you that you can be, and growing and understanding that educating yourself and learning how to grow is your responsibility, and the buck stops with you. And that's really it. Quit trying to look for a magic pill. Quit trying to look for a magic solution. There isn't one. The solution is you doing what is necessary to achieve an outcome that in today's day and age is not a common outcome, right? If everybody were doing it, then we would have a social paradigm that was pushing everybody and influencing everybody to believe that eating right was the absolutely best thing to do, and that exercising was absolutely one of the best things to do. But our social paradigm is one that it's okay to change your gender, it's okay to not exercise, it's okay to believe in all the little lies, right, that prevent you from making real, truthful decisions about your health, and then you end up wondering why you can't get better. Anyway, another rant finished. Let's go down on the right. How harmful is it to take supplements that contain rice or ascorbic acid made from corn if you're gluten sensitive? I ask because I'm considering going grain-free too. I don't use them, Kersey. I just don't recommend them. I've seen too many people react to the rice powders in a variety of different products, even the ones that claim to be gluten-free. And so that's why we don't play with those things. That's my advice. What enzymes would you recommend for a diabetic? Depends on what you're trying to achieve, Betsy. If you're trying to achieve better digestion, I'd recommend a good broad spectrum enzyme that has lipase, amylase, protease in it. You're going to get good improvement, support of digestion of carbs, fats, and proteins with a formula like that. If you're trying to take enzymes that are like proteolytic enzymes, it just depends on what you're trying to accomplish with those things. Some people will take, for example, serrapeptidase, which is it kind of has an inflammatory regulatory property so to the blood, as does nattokinase. Some people try to take proteolytics on an empty stomach for the same reason. What I would suggest that you do, Betsy, maybe might find it helpful to watch my interview on enzymes. We did an interview a while back with Dr. B on enzymes, and that might be helpful for you to kind of decide what you think would be best for you. Is balsamic vinegar good if you're gluten sensitive? Yeah, it's gluten-free. It's fine. It's high. It is higher in sugars, and so you got to be careful a little bit with that if you're trying to regulate your sugar. But as far as a gluten is concerned, it doesn't have any. Can you take Lugol's iodine while on Synthroid? Yes, but you should always talk to your doctor and make sure there's no other health issue that is complicating in your situation. CoQ10 for someone over the age of 60, best form in general. Ubiquinone, best form. I don't know if I answered your question, but ubiquinone. For the past year, my forearm muscles fatigue when performing fine motor skills while writing and using scissors, but no issues while lifting heavy weights. What could be the cause? I mean, you might look into mineral deficits. Calcium and magnesium deficiency can create problems along that route. So you might want to look into those as being a potential issue. You might also, if your forearm muscles are the issue, are they weak? Are you exercising those enough? A lot of times when people go to the gym, they don't really work their forearms out. They work their bigger muscle groups, but not their calves or their forearms, kind of take a back seat typically. So it could just also be that you're not exercising them adequately. Long history of acid reflux, 2 years ago diagnosed with hiatal hernia. Would you encourage an endoscopy to make sure everything is okay, or just go with the hiatal hernia diagnosis? Personal decision, Lisa. I find a lot of times that when people have been diagnosed with a hiatal hernia, it's a stamp for the rest of their life that they're going to need to be on some type of antacid, at least according to a lot of times their doctors, their GI doc or their GP. You got to figure out why you have the hiatal hernia. What can damage the valve that could contribute to or lead to a hiatal hernia? And I've seen gluten do that, and I've seen other things do that as well, other nutrients and microbes and chemicals and foods that can damage that valve. So figuring that part out is going to be important. Now, could you do a scope? Yeah, you could, but a scope, you have to remember the limitations of the scope as well. The scope is designed to look for damage. It's so you go in, it's a camera, right? And it's, the old cliche, don't judge a book by its cover. And that's, what a scope is it's judging the book by its cover. It's telling you, yeah, we see a problem in this area or that area, but it's not telling you why the problem exists. It's telling you that the problem is there. And if you would sleep better at night knowing that you have a specific problem in a specific location, then get the scope. But at the end of the day, if you know you have a problem in a particular area, you want to kind of know why that problem is there. And I think that's where a lot of times the scope is going to fall short. Now, if you have a fantastic GI doctor with a functional mindset, then, a scope plus a consultation with a doctor like that might go a long way for helping you understand the why. But knowing what without knowing why, in my opinion, is an exercise in futility. Tingling only started after being carnivore for a month. So following up on that carnivore question, if you're developing tingling after being on a carnivore diet for a month, it's very possible you're malnourished. I don't know what kind of carnivore. A lot of people, when they go carnivore, depending on what you're eating, if you're eating a lot of organ meats, you're going to get more nutritionally dense foods. But if you're just eating meat and eggs, it's very easy road to develop micronutrient deficiencies that could contribute to neuropathy. And so Sandra, you might want to get yourself nutritionally tested to see if that's happened to you over the past month. Let's see here. After 30 days, based on your book, can I introduce legumes in coffee and chocolate? The book, so if you're reading No Grain, No Pain, the book, the 30-day diet is just the jump start. And so whether or not you should introduce legumes, coffee, and chocolate are debatable as to, one, whether or not you're sensitive to legumes, coffee, or chocolate, two, whether or not your digestion can handle legumes, coffee, and chocolate. And so a lot of the reason why we avoid those in the No Grain, No Pain diet is because a lot of people have years of chronic inflammatory damage caused by gluten to their guts. And so their guts are not capable of processing or digesting those legumes as well. So we keep them out to not overwork the GI tract. Coffee and chocolate both have caffeine that can be irritants to an already irritated gut lining. And so, again, it depends. It depends on whether or not you're feeling fantastic and you want to try introducing one of those at a time and just kind of see how your body adjusts, then that would certainly be a reasonable thought and a reasonable thing to try to attempt to do. But if you're just not sure, getting tested for sensitivity to those things would also maybe be a good idea for you. If heavy metals are detox, can that heal LATA? If you mean late in adult onset diabetes, probably not. I mean, I've seen, look, this is not something that I personally see every day in my practice. I've seen cases of LATA and nutritionally supported people. I've seen one case not need insulin anymore. One case, but I would never make that claim for everyone with that type of diagnosis. I mean, if you've got a heavy metal issue and you suspect that it contributed to your LATA, you should work on detoxification, but you should be working with a good doctor who understands that, and the outcome will speak for itself. But whether or not, you'll completely, resolve the situation, that's only time can give you the answer to that. HLA-B27 positive iritis, uveitis related to inflammation due to food? Absolutely. I had one time, we actually have a video of this. There's one client of mine that she had the same diagnosis. She was HLA-B27 positive. They were injecting steroids into her eyeballs. If you could imagine a long needle going into your eyeball. Insert cringe. That's awful. Anyway, she made a full recovery, full remission with diet change. It was food. And part of that was nightshades. HLA-B27 positive individuals usually do much better not eating nightshades. So potatoes, peppers, any type of tobacco is part of the nightshade family as well. Goji berry, the nightshade family. But also she was gluten sensitive. How much protein does Peter Osborne eat a day? It varies. I mean, I do count several months out of the year. I'll do my macros and I'll count for specific reasons. And, when I'm counting my macros, if I'm trying to beef up or trying to get stronger for whatever variety of reasons, I'll do about 1.5 grams to 2 grams of protein per kilogram of my lean mass. So, that generally will equate to anywhere between 140, 116 grams of protein on, when I'm trying to do something like that. But as a general, like day-to-day maintenance, if I'm happy, about 100 to 130 grams of protein a day is usually a pretty good place for myself. I don't think there's an exact right number. There are a lot of calculations and math equations that people could do to try to get a good determination of what their protein needs are. But I think at the end of the day, it's an individualized decision that everybody should make based on how their body reacts and responds. And one of the biggest areas where protein is underrated is if you're training a lot and you're not recovering. And that's a hallmark that you need more protein. Let's see here. I think we're running out of time. I think we're out of time, but I'll take one more here. What can I do for Barrett's esophagitis or esophagitis? Also have hiatal hernia. I think we answered a question on that earlier. Just been diagnosed with Barrett's. Gastro has me on lansoprazole. What to do after that? You got to figure out why you have it, Jenny. Most cases of Barrett's, in my experience, respond extremely well to diet change because you have the erosion and the infiltration of immune exudate in the esophagus because a lot of times because of food being the irritant. So common causes that I have seen for Barrett's: gluten, dairy, definitely sugar, but then it could also be random assortment of other foods. So getting that piece figured out, in my opinion, for you would be really a smart thing to do. All right, I think we're out of time. Thanks for tuning in. As always, I appreciate you guys spending your day with me. I know your time is valuable, and I hope you walked away from this episode learning something new. That's always our goal, is that we can pay it forward, the knowledge, so that then you can go out in your life and pay it forward in your own health, but also to those that you love and care about. Remember, our mission is to help save 100 million lives. That's hashtag save 100 million lives. And the way we do that is we show up every week trying to be better and trying to spread knowledge. And how you can help me in that mission, you can share this video with somebody you care about. You can also come visit me at glutenfreesociety.org. Sign up for our newsletter there. It's free. We'll send you all kinds of fantastic information on how to overcome autoimmunity with diet and lifestyle change. And so I would encourage you to go take advantage of that free resource. Also, below this video in the description, you're going to find an array of different links. These links are to key elements that I think are very important that all of you should understand. One of them being our Glutenology Masterclass. If you have not taken that class, it is also free. It's about 14 hours long, but very much worth your time. If you're trying to navigate a gluten-free diet and you're confused, that's a great place to start to get you on the right track in recovering your health. Again, thanks so much for tuning in. We'll see you next Tuesday night. And again, not next Thursday. We're taking July 4th off, and we wish you a fantastic holiday weekend because I won't see you until the following Thursday. So take care. We'll see